All right, so in this video we're going to go over the general structure of vertebrae, some of the different vertebrae in the body. We'll go over ribs, the sternum, and the sacrum. So we'll start here this video going over the general structure of a typical vertebra, which we see here. Now, most vertebrae along your spine have a body, which is this part right here. And the body is just the main part of the vertebrae, hence the name body, just the main sort of chunk of the vertebrae. Okay. Now, most vertebrae also have transverse processes, which, because they stick out laterally, are called transverse processes. They also have a spinous process, which sticks out posteriorly along your spine. That's what you can feel along your spine. They're going to have a space here called the vertebral foramen, which allows for the passage of your spinal cord. Now, there are some other structures here in the vertebrae that are a little bit more minute, but we can see them here if I wrap the pipe cleaner around it. Now, the pipe cleaner here is wrapped around a little segment of bone called the pedicle. Now, the pedicle is what connects the body to the transverse process, and that's what the pipe cleaner is wrapped around here. So if I pull this away, you can see that that's the pedicle, which is just a little piece of bone connecting the body to the transverse process. Now, over here, we can see another segment of bone called the lamina, which connects the transverse process to the spinous process. And if I wrap the pipe cleaner around that, I can illustrate this lamina a little better. So the pipe cleaner here is wrapped around the lamina, which connects the spinous process to the transverse process. Just this little segment of bone there. So that's the lamina. Now, these two large superior processes in the vertebrae are called the superior articular processes. And there's two of them here. Now, what these superior articular processes do is they connect to the vertebrae above. And if we look down here, these are the inferior articular processes, and they connect to the vertebrae below, or inferiorly. Okay. Now, between most of the vertebrae, you're also going to have an intervertebral disc, which isn't shown here, but there would be a little thing of fibrocartilage over on the body here that helps cushion between the two vertebrae. That's called the intervertebral disc. It would be here. We do have some vertebrae in lab that have those, and it looks kind of like a little gelatinous piece of kind of tissue that connects right here. Now, if we look back here to the vertebral foramen, this is called the vertebral arch, which is really made up of your pedicle and your lamina spinous process. That's called the vertebral arch. Okay, and that's really it for the general structures of those vertebrae. Now, what we're going to do is talk about then some of the specific structures of different vertebrae along your spine. So what I have laid out here, you guys, are the three different types of vertebra along your spine. We have cervical vertebrae, thoracic vertebrae, and lumbar vertebrae. Now, lumbar are identifiable because they kind of look like a moose, which we can see here. Okay. Now, thoracic are identifiable because they kind of look like a giraffe. And cervical are identifiable because they're the only ones that have transverse foramina. So this is a transverse foramen, which you only find on cervical vertebrae, and it allows for the passage of the vertebral artery, which supplies blood to your brain. Now, there are 7 cervical vertebrae, 12 thoracic, and 5 lumbar vertebrae. So there's a good kind of mnemonic to remember this. That means, think 7, breakfast at 7, cervical vertebrae, lunch at noon, 12 thoracic vertebrae, and dinner at 5 lumbar vertebrae. So 7 cervical, 12 thoracic, 5 lumbar. In fact, what's nice is that one of the reasons that makes it easier to remember those 12 thoracic vertebrae is there's also 12 pairs of ribs that attach to those vertebrae. Now, this is just a general structure of a cervical vertebrae, which you can see it has most of those same components that we talked about. It has a body, it's got some transverse processes, a spinous process, it's got a lamina and a pedicle. But what's different is we have the transverse foramen here, and that's really what's identifiable between the cervical versus any other vertebrae, is that cervical only have these transverse foramina. Now, cervical also can have a bifid spinous process, and bifid means it's split into two. So we see here then is that this is the spinous process where it's kind of split into two. That's called bifid. And cervical vertebrae have that characteristic of a bifid spinous process. Okay. Now, These two vertebrae are also cervical, but we look at these as being specific vertebrae along the spine. And these are the two specific vertebrae that we'll want to identify. So this one is called the atlas, which is also the first cervical vertebrae. It articulates with the occipital bone, specifically the occipital condyles. And this one is the axis, which is the second cervical vertebrae. And it's identifiable because it has this large process sticking up called the odontoid process. Now what happens is that the first cervical vertebrae will articulate here with the second, and it pivots around axis when you rotate your neck. So if you have lateral and medial rotation of the neck, it'll pivot around that axis. Now, something that's unique to the first cervical vertebrae is that it doesn't have a body. There's no identifiable body here. Okay? It does have the transverse foramina, like the rest of the cervical vertebrae. It also doesn't really have much of a spinous process. There's kind of like a little nub there, but it's not really a very prominent spinous process. Okay? Now, for the axis, or C2, the only specific feature we want to identify in this vertebrae that's different from the rest is this odontoid process, or dens, which means little tooth. Now, for the lumbar vertebrae, the thoracic vertebrae, they have some of their own specific structures that we don't find on other vertebrae as well. Because the thoracic vertebrae serve as an articulation point for ribs, so the ribs attach to your thoracic vertebrae. What we find then are something called the costal facets. So if you look closely here, this is the superior costal facet, which would be an articulation point for the head of the rib. This out here on the transverse process is the transverse costal facet, which would be an articulation point for the articular tubercle of the rib. But the rib attaches twice to the thoracic vertebrae. Now some ribs attach, some thoracic vertebrae attach to more than one rib, which is what we can see here. This is why there's an inferior costal facet, because another rib also attaches to the same vertebrae. However, it connects to a different transverse process on another vertebrae. Okay? Now, again, remember, thoracic are identifiable because they kind of look like giraffe, and lumbar are identifiable because they look like moose. Lumbar also have the largest bodies because they have to support the most weight. So their bodies are very large. Their spinous processes are kind of short and blunt, so they're not as sharp as the thoracic vertebrae, which have a more sharp spinous process. Now, that's it for the vertebrae. Now we're going to move on to the sacrum. So the sacrum is made up of about 5 fused vertebrae. Now, when they're fused, what that means is that they're separate vertebrae in development that became one large bone, which we call the sacrum. Now, the sacrum allows for the passage of some spinal nerves through a sacral canal that goes down the posterior side of the sacrum. And it also laterally, this part of the sacrum articulates with a bone of your pelvis called the ilium. So the sacrum serves as a really nice sort of keystone bone that helps attach not only to your spine over here, but also to your pelvic girdle over here. Now the sacrum also has another bone attached distally, which is the coccyx right here, which is your tailbone. The coccyx is made of about 3 to 5 fused vertebrae that form your tailbone. Now this serves as an important anchoring point for some of the muscles of your pelvic floor, so the pelvic floor muscles down here that are involved in things like coughing and defecating, those attach to the coccyx right here. So that's the coccyx. Now for the ribs, we don't need to identify any specific structures on a rib, just know that this is a rib. Now the root for a rib is costal, because if you look at the rib, it kind of looks like the edge of a coastline, hence the name costal. And this is just a general rib. Now the ribs attach to your thoracic vertebrae like this. Now this one doesn't attach that perfectly, but this is where the rib would attach. So the head of the rib attaches to the body, the articular tubercle of the rib attaches to the transverse process of the thoracic vertebrae. And all the ribs are attached like this, and they're going to help form your thoracic cavity. Now, there's different types of ribs. We have true, false, and floating, which we'll talk about in the next video. But for the ribs attachment, many ribs attach to the sternum. The sternum is what we call like your breastplate. It's made up of 3 different segments. we have the manubrium of the sternum, which is this large superior part right here. We have the body of the sternum, also called the gladiolus, which is this main center region. And we have the xiphoid process of the sternum, which kind of points out down here. Now, the xiphoid process serves as an important attachment point for your abdominal muscles, which you use to flex your trunk, and they attach there to the xiphoid process. The manubrium of the sternum serves as an important attachment point not only for ribs, but also your clavicles. So your clavicles, which are part of your appendicular skeleton, they articulate here to the manubrium of your sternum. Okay. All right, so in this video we're going to go over the different types of ribs. We have true, false, and floating ribs. The true ribs are called true because each rib has its own attachment of costal cartilage to the sternum itself. So each of these ribs is all a true rib. Okay. Now the false ribs will share a costal cartilage going up to the sternum. So these are false ribs here. And the floating ribs are the last two pairs, so numbers 11 and 12. And these are called the floating ribs because they don't attach to the sternum. There's no costal cartilage on these ribs going to the sternum. Hence, they kind of float there on the inferior part of your back. That's it.